Grace Clinic serves uninsured adults, and we also serve Medicaid patients. Part of our responsibility to the community is helping people when they're at the worst times of their lives. If you've lost a job and you have lost health insurance, it can be the worst time in an adult's life. And so we're part of the solution. We want our public to know that we exist and that we can provide medical care during the time that they're unemployed or they don't have insurance. That's much of what we do. We were so grateful to get the Invest in Surry funds. We sat down as a team and decided what would most benefit our clinic and what would directly serve our patients. And the first thing we did is we purchased a piece of equipment for our lab.
We purchased a CMP machine. It's this machine right here, and it's a comprehensive metabolic panel. And what that tells us is it helps us titrate medications in about 13 minutes in-house. We can have results for the patient and for the provider. It reduces a lot of those unnecessary phone calls, playing phone tag with the patient and the provider. And, it tests liver function, kidney function, glucose, electrolyte levels. All those levels can be very dangerous if not treated quickly. So we see a lot of diabetic patients, lots of titration of insulin. We can titrate kidney medications. Patients are taking potassium or calcium. Those are some of those electrolyte levels that are critical to changing those doses.
When a medical provider titrates the medications, they start at a level that they think is therapeutic. And then with testing, they're able to adjust those medications. So that's where we get into the titration. Grace Clinic is primarily a medical clinic. We do primary care. We, just like any other doctor's office. What makes us different is that we have added services. We do, so as you know, we do some in-house labs, but we also have behavioral health services. Patients can get it here all under one roof. We do specialty referrals. We do medication assistance. We, for example, a diabetic who's uninsured, medication for whether it's blood pressure or for their insulin, it's unobtainable, and so we help with that. We have an aggressive pharmacy assistance program, and with that program we bring about $2 million a year of free meds to our patients. Now these are not narcotics, these are medicines for chronic disease such as hypertension and diabetes.
My name is Dr. Steve Ernst. I'm the medical director at the Grace Clinic here in Elkin in the Yadkin Valley. I've been associated with this clinic for more than 20 years. We started 20 years ago. We started in the basement of the Methodist Church. A preacher, a nurse, a community health nurse, and a high school teacher. We all got together and noticed there were needs in our community, a lot more for transportation and medication is how we started. And then we realized there was just a need for health care. There were people that did not have health insurance, were between jobs, or out of work. They just did not have health insurance, but they still had diabetes, they still had hypertension, they still had other needs. And we started off by mainly getting medications for patients. We had some funds from the church for community health and outreach. And so we all got together and then we said, well, we need a place, and the Methodist Church said we got an empty space in the basement. So we started there, and we had a nurse, and I've been doing this for 20 years. I've been on the board of directors and trustees, and it's just a wonderful thing to be able to connect with your community and be able to help them be healthier, because many people just don't have a place to go. I feel like we've prevented suicides, heart attacks, strokes. We have patients with cancer that we get proper treatment for. We have people with diabetes that need medications, and we help them get medications. But thanks to Surry County and other local people, we are able to continue. We're working on a new building we'll be moving into, hopefully September, I think, is we're moving in the new building. But this is a great opportunity to connect with our community and to help our community and help our community be safer and stronger. Well, we have so many people that say thank you. I might see people in the grocery store and say thank you for helping my son, thank you for helping my daughter, my husband. We have people that come in with chest pain, people that come in with just simple problems even, and we help them feel better, help them get back to work, help them be productive members of the community, and it just feels good to be a part of that bigger issue in helping our community be healthier, better, and safer.
We're at our new location just down the street from our current clinic. It's about a quarter of a mile. We hope this project will be completed in September or October. We have engaged Garanco, a local firm out of Pilot Mountain, as our general contractor. This is Daryl Oakley, the building superintendent that we work with on this project.
And I'd like to thank the Grace Clinic for giving Granco the opportunity to do this job. And it has been a pleasure working with the Grace Clinic.
We're grateful for the Invest in Surry funds. We also used some of the funding to purchase lettering, which will go in our new building. And we also had about $21,000 left over, and we're using that just for the general construction of this building. But it was our first money to go towards this project, and we're very appreciative. We invite you to call us. Give us a call if you think there's something we could help you with.
The clinic's existence underscores the pressing need for rural healthcare today, as these communities often face significant challenges, like physician shortages, limited access to specialty care, higher rates of chronic diseases, and greater barriers due to poverty and lack of transportation. Organizations like Grace Clinic play an indispensable role in bridging these gaps, ensuring that vulnerable populations in rural areas receive the essential medical and supportive services necessary for their well-being, often preventing more severe health crises and improving overall community health outcomes.